In light of Sexual Assault Awareness Month, RevNow is partnering with Dr. Vanessa Rodriguez, a trained therapist who specializes in sexual assault survivors, to create a three-part series about survivor mental health. Thank you for being with us today, Doctor. All right, well, we'll be kicking off the first part of our series by talking about coping techniques for survivors. Now, my first question for you is, what are some immediate steps we can take after being assaulted? Because as a sexual assault survivor myself, I didn't know what rape kits were. And
Yep.
so,
Yeah.
yeah, it's
A lot of
very
people
good.
don't.
Yeah, so what can you tell me about that?
So, this is an ideal situation, right? If you experience a sexual assault, ideally you want to report it immediately. The practical piece of that is what's important with the rape kit, as you mentioned, is to keep the clothes that you have. Oftentimes, after a victim experiences a sexual assault, they want to completely get rid of everything that reminds them of the assault. They want to shower. They want to just almost like a cathartic, get this off of me. I can't, I feel icky, right? And so that, again, this is an ideal situation. You would report it. Ideally, again, too, before calling the local law enforcement, you can always contact your rape crisis center. That would be what I would recommend, because every department and jurisdiction, they handle the kind of the practical piece a little bit differently. Sometimes they dispatch nurses to the hospital. Sometimes they're at specific hospitals. So I would go through them if you can. But if you were to contact the local law enforcement, report it, then they would, you would go to the hospital, and then they would do a SART exam or rape kit. And it's pretty intrusive, and it can be an additional, it can be traumatizing. And so it's important to, if you go through your rape crisis center, or to have an advocate with you, or to have a friend. So basically a support for you, because it's scary, so you just had experienced a trauma, and now you're going through another traumatic experience, even dealing with that whole process. And there's a lot of information that's being um, given to you at that time. And our brains, we can't really process everything. We're probably not really even present. We're probably a little checked out still from the immediate trauma, if this is kind of the ideal situation. But of course, you can always contact your local rape crisis center if it's been days, weeks, months, and you won't be able to go through that process, but you can still absolutely go through the legal aspect of reporting the assault.
Okay. And is there a typical process for recovering for sexual trauma? I know that they have a short-term and long-term trauma. Could you explain that a little bit?
So, trauma is experienced differently by everyone, right? With sexual assault and rape, they do have rape trauma syndrome, and with that syndrome, they break it down into 3 different phases. One being the acute phase, which the victim has more of an expressed reaction, so maybe crying, maybe really agitated, just uncontrollable crying, bouts of crying, and then maybe after that they are more controlled, where they are beginning to repress it, like everything's fine, nothing happened, I'm okay, it's okay, let me just push it down, let me push it down. And then they go through kind of this shock, disbelief stage. What happened? I can't believe this happened. What's going on? what's wrong with me? Did I cause this? I shouldn't have done. Just this kind of shock disbelief. They can't even believe what really occurred. Um, and again, that phase right there is different for everybody. There's no real time frame. Emotions don't have a calendar, so it's different from person to person. The second part of the phase, they call it the outward adjustment phase, and that's a lot of kind of cognitive processing or distorted cognitive processing. Um, Again, kind of minimizing the assault, suppressing the assault, trying to explain and analyze every single detail to try to make sense of it. And a lot of times during the assault, we kind of have like snapshots of or images, and so you don't really have the whole story, and so we're trying to fill in the blanks. Again, this is kind of a typical process that our brains are working well, because we're trying to make sense of it. But then we kind of perseverate and just really hyper focus, and it almost consumes us. Um, and then also this flight um, piece, meaning we maybe cut our hair, we change the way we look,
Yep.
maybe we try to change the way we dress. Maybe we start gaining weight to not be so attractive and not cause attention. And so maybe we change locations, even change our room and our house. And so we want to try to escape and a flight from it. And the last phase um, really is about trying to reacclimate, reclaim yourself. And again, this process is very, very different for everyone. That what I just explained right now really applies to sexual assault and rape, but the bigger umbrella to that is post-traumatic stress, right? And post-traumatic stress disorder, they've done studies where in emergency rooms where they tracked victims of sexual assault and for 3 weeks, and they followed them for every week, really assessing this post-traumatic stress, the symptoms. And 2 weeks after the assault, um, 94% of the victims had met criteria for post-traumatic stress disorder. And then a week later, on the third week, it went down to 49%, which yes, it's lower, but it goes to show that time doesn't heal when it comes to trauma, right? What you don't feel, you don't heal. And one of the big hallmarks with post-traumatic stress is avoidance, right? And so we, after an assault, we want to avoid everything and anything that reminds us of that assault. And the reason why we do that is because we get a sense of relief. We get a sense of safety when we avoid it. But what happens is as weeks, months, years pass, we still have these PTSD symptoms, and we're not really, the time heals. No, I mean, it'd be nice, but you have to process and go through that work. And PTSD is a lot of people have it, and they just don't really know it because that's become their new norm of functioning. But you absolutely can remit PTSD through group therapy, through individual therapy. There's tons of different types of treatment for PTSD.
Yes. Yes, I know what you're talking about. I have PTSD myself actually from that,
Right.
so totally understand. So many people out there, more than we
I know.
realize.
I know.
So you actually knocked out a couple of my questions there.
Okay, sorry, I can
No,
talk
no
forever.
problem. No, no problem. Seriously, that's what I want actually. So, what my next question was though, you kind of answered it, but I want to go a little more into depth of how do survivors stop themselves from downward spiraling? Now, what I mean by that is like you talked about, like like me, I had bright red hair. I dyed it bright red. I partied all the time. Like
Yep.
I just totally different person.
Yep.
So how can we stop themselves or at least like divert ourselves from doing that?
Right. It's really difficult to pause that, to intervene on ourselves. And even we can have friends and family even try to intervene, and the guilt and the shame that we experience after a sexual assault is insurmountable. It's debilitating, right? So that downward spiral, you keep spinning, 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 and it's interesting. What people don't really know is after or I shouldn't say some people after an assault, you know, um, it's pretty common for victims to become promiscuous, um, which is that part of that downward spiral, right? And it sounds almost counterintuitive. Why would you become sexually promiscuous after you've just been violated, right?
Mm-hmm.
But this downward spiral has to deal with feeling this like we've lost control of our lives. We've lost um, power. We've lost the ability to make choices. So all these kind of high risk behaviors or um, choices or behaviors that we're doing that don't really match kind of who we were pre assault. It's all these attempts really to regain power control in your life again. And so it's really having about this piece is really about having self-compassion, right? Having compassion for what you've been through, right? And kind of understanding, making the connection that I'm doing all these kinds of whatever the spiral looks like, right? It looks different for everybody. Um, but that these are all failed attempts to try to get security, try to feel safe, try to get autonomy again, right? Because sexual assault and rape is the most extreme form boundary violation, on the planet. That and domestic violence, um, and so it's really to combat that is really having self compassion for what you've been through.
Yeah. All right. And what are some myths? I've been researching a little about myths about rape and sexual assault, but do you have any that survivors often find misleading?
Oh, yeah, there's a lot. There's a lot of myths, and it's so sad. The most common one is the jogger. You're jogging and someone jumps out of the bushes, and those are the types of sexual assault or rapes that are common or that occur. No, that those are minute and compared to the actual perpetrators of sexual assault and rape. The majority of victims, in fact, know their assailant. There's a lot of rape by intoxications. You can be sexually assaulted in a relationship, um, with a boyfriend, with the husband. So that's the biggest, I think, myth is about who the assailant is, right? Um, Other things that rape gets overreported, or not overreported, false reports, right? It's less than 5% statistically. Um, and then another, oh, they must have wanted it because they didn't fight back. Absolutely not. Again, that's part of trauma, right? When you are in it, right, experiencing a trauma, we have they have fight or flight, right? But they also have freeze. It's this think about animals. It's kind of a strange example, but when prey is coming along, there are animals who know that they're in danger, and so they play dead. They act dead until the threat passes. And once the threat passes, then this animal feels safe and then they run, right? And that's so really what happens during these assaults, right? That the victim becomes paralyzed. They are frightened. They freeze. And so they don't fight back. And in addition to that, not only do they freeze, they're in the moment, they are surviving, so they're doing anything that they can um to maintain, really, until the threat passes. And so just because someone, after you get assaulted, say it's a friend or a partner, and they talk and they communicate, that doesn't mean that they wanted it at that time or wanted it, ever. Um, Maybe they still are in that survival kind of piece of it, where maybe they feel that they need to have some sort of amicable communication with this person because they're scared, they're so terrified. Um, Obviously the kind of other common ones, oh well, if she, the dress, she must have wanted it because of what she was wearing and how she was acting and how she was flirting. And no, you can do that all day and night, and at the end of the day, if you do not want to be with someone intimately, sexually, you have every right to say no at any time.
All right. And my last question for you on this section would be, how can survivors challenge feelings of helplessness and isolation or guilt and shame?
Right, and it's kind of what I was talking about earlier. Is it's this idea of self-compassion, right? We tend to we we tend to just it's hard to get out of shame, right? What's wrong with me? I can't believe I let this happen. How come I didn't do anything? It's all my fault. Talk about a downward spiral, right? And with the shame, it's debilitating because it's as if we did something wrong, right? And we did nothing wrong. We did everything we could do in that moment to our the best of our ability, right? And so having guilt, shame, isolation, it's all part of the process, and it's okay to feel that, right? It's okay. How do I say this? So obviously, shame does not feel good. Feeling helpless, depressed, sad, guilt, all of that sucks, right? It does not feel good. But in some weird way, it's okay to feel that, right? It's totally common, totally normal. And so kind of allowing yourself to experience, like I said, um, you have to feel, right, in order to heal. That's the catch 22 when it comes to mental health and just life. And but if we feel all of these quote unquote negative feelings, we have to make sure we balance it out, with more positive feelings, right? And that big umbrella is about compassion, right? Um, and feeling as if you to forgive yourself, right? Not forgive yourself that you did something wrong, right? It's this sense of this relief that we get to so we can heal and not have it have such a strong hold on us that it consumes us.